All right, welcome. I see everyone coming in and getting audio. All right, before we get started, please add your name and facility in chat. It's really helpful to know who's here, and seeing familiar names is always great. And we're just going to get started in just a few here. If you're just connecting to audio, welcome. We're going to get started in just a few. All right, let's get started. So welcome to our 30-minute session on Nursing Home Quality Essentials. My name is Rosanna Milanovic, and I'm a Senior Quality Improvement Facilitator. And today we're discussing health equity and health literacy and quality improvement interventions. Also, make sure to join us every last Tuesday of every month for health equity topic. And be sure to add QI Connect to your list of email contacts and check us out on Facebook and LinkedIn. Intelligent has a listserv for our nursing home partners. And if you're not signed up, please use the QR code here to sign up. Being on the listserv means that you'll receive notifications of critical updates from Intelligent, CMS, CDC, and you'll receive information about upcoming events and trainings. Also, you can engage in peer-to-peer sharing. So for example, you could send a question and your peers in other nursing homes can reply based on their practices or tools that they use. Intelligent has an assessment dashboard that organizes 5 assessments that help support you to identify any potential gaps in these areas. And it's a great place to start, and then a quality improvement facilitator can help you prioritize that area of focus based on your facility's needs. All right, let's get started with health literacy and quality improvement intervention. So this is a broad topic, so we're going to start with these objectives. I won't go through them for the sake of time, but we will discuss health literacy with a focus on some interventions to utilize in your community. So in the last year, we've learned more and more about the importance of health literacy, especially with the new addition to the MDS. And when talking about health literacy, it's important to understand the meaning of health equity. And health equity means that everyone has a fair and just opportunity to be as healthy as possible. So this is different from equality and everyone being treated equal. This is a focus on ensuring individual needs are met. So just briefly, what is health literacy? So personal health literacy is defined as the degree to which individuals have the ability to find, understand, and use information and services to inform them of health-related decisions and actions for themselves and others. And then organizational health literacy is the degree to which organizations equitably help people to find, understand, and use information and services to inform health-related decisions. So essentially, this is the process or health literacy program you're implementing in your facility. So I'm going to ask you a health literacy question, and please don't worry about wrong answers, and feel free to put this in chat. But out of 10 adults in the United States, this many individuals struggle with health literacy. And if you're comfortable, again, type in the letter that you think is correct. And while you're typing that, I'll put in, I want to share a quick health literacy fact. So only about 1 in 10 English-speaking adults in the US has proficient health literacy skills, and the remaining 9, about 50% have intermediate health literacy skills, and a little over 1/3 have basic or below basic health literacy skills. So when you think about it, that's a large portion, and think in terms of your resident population, it can be even higher. So another health literacy fact, limited health literacy disproportionately impacts Medicaid members. And 60% of people with Medicaid coverage are either at below basic or basic health literacy. So I see Billy, you put in C. Thank you so much for being brave and putting that in chat. The correct answer is 9, or E. So great job if you did get that, but 9, that's such a high number, 9 out of 10 adults in the US. So I want to share really quickly a video called Health Literacy Fast Facts, 5 Things to Know. And it's a quick overview of health literacy. And then we're going to take a deeper dive into verbal and written communication strategies that you can use in your nursing home. And Jason, he put the link in chat just in case. All right, thank you. Is there any questions, anything that was brought up for anyone? I hope you could hear that. If not, Jason put that YouTube link in the chat for us. But I just wanted to share, here's some health literacy facts. And as we go through these, please think about your nursing home population and those you're serving. And this can be residents and their families or their medical power of attorneys. So low health literacy influences how someone navigates the healthcare system. And it's difficult for some and very difficult for others, especially individuals 65 and older. So limited health literacy is, like I said, very difficult for individuals from a low socioeconomic status, income level, or educational level. So when your social worker or staff is completing that admission psychosocial, there's a question about education level. And this information can clue you into the health literacy needs, especially if you have a younger population. Or when you're gathering information from section B in the MDS, the question includes, how often do you need to have someone help you when you read instructions, pamphlets, or written materials? So this also provides that information. Those that identify as Latino, Black, or American Indian and Alaska Native, this information you receive upon admission to complete your MDS as well. And then individuals with limited English proficiency and or non-native English speakers. This is also that great information captured in the MDS. But how do you use this information and what interventions do you use? And then finally, people uninsured or insured by Medicare or Medicaid. And then anyone can struggle with health literacy. And think about when you're at the doctor and they're explaining something to you, how much are you understanding and remembering? I need to jot down notes so I remember, and I've learned that I need to ask questions. And in the past, I sat there and listened and nodded my head in agreement, but then I leave and I can't remember half of the conversation and those important details of how I need to follow up appropriately. So, thinking about your nursing home population, the impact of low health literacy is incredibly important. So, what is the impact of low health literacy? So, medication errors. Think about post discharge. Do you ever worry about if a resident is going to be able to manage all of their medications, even with the help of home health coming in a few days a week? Difficulty understanding and following care plans, reduced use of preventative services. So, for example, consenting to vaccines. Challenges managing the complexities of chronic conditions like diabetes, longer hospital stays, increased hospital readmissions, and increased emergency department use. And also confusion about appropriate responses to public health emergencies, and also higher mortality. Something we might not think about, but health literacy is an everyday issue. Residents make choices about their health every day in the nursing home, including what they eat, conversations with a physician, consenting to procedures and assessments, taking their medication, and especially that admission and discharge process and returning to the community. So just a question, do you use informal or formal resident assessments, especially to complete the newer section in the MDS? Also, I'm just curious, what verbal and written interventions do you use to address low health literacy in your nursing home? And if you're using anything, please feel free to share that in chat. I'd love to know what you're currently using. So the first strategy we're going to go over is called the SHARE approach, and SHARE is an acronym. And the Agency for Healthcare Research and Quality, or AHRQ, created this approach. And this intervention is a 5-step process for shared decision making that helps to examine and compare the benefits, the harms, and risks of each option through meaningful conversation about what matters most to residents and what's best for them. So as you can see here, S is seek your residents' participation. And in the case a resident has a medical power of attorney and an appointed decision maker, the same applies to seek participation. The H is help your resident explore and compare treatment options. And A, assess the residents' values and preferences. And in nursing homes, the goal is to provide person-centered or person-directed care and ensure shared decision-making is occurring. So if your goal is to show you're using shared decision-making with your residents, this is a great intervention for staff to use. And then R, reach a decision with your resident rather than telling them what's going to happen. And E, evaluate your resident's decision. And the SHARE approach really focuses on that shared decision making and takes into consideration the residents' values and preferences. And I know this is a priority for nursing homes, so this is a great intervention for staff to practice. Also, both the staff member and the resident benefit from using that shared decision making that include improved participation in care planning. And this strategy builds a trusting relationship between the staff and residents. For example, in terms of informed consent, SHARE helps to ensure that residents' consent is truly informed because you're assessing a resident's values and preferences, reaching a decision with your residents, and then evaluating that decision. Also, clear communication builds trust. So think about all the procedures, the treatments, the medications, admission agreement, forms for informed consent a resident or medical power of attorney receives in a nursing home. The shared decision making is not telling a resident or family member about a treatment or medication. It's about working together to make a healthcare decision that's best for the resident. And a resident may not always be open to a treatment or medication, but the SHARE approach helps with the process of communication by providing an outline to follow. And you can use these flyers in your facility as a visual reminder and a reference for staff. And on the AHRQ Share Approach website, there's a toolkit with training guides, slides, videos, and resources to help implement staff training in this intervention. And there's several short videos, and they're under 10 minutes, that provides a different scenario. So for example, in one of the videos, a physician is discussing a medical condition with a patient not using the share approach, and then another video using the approach to model the improvement in communication. And there's also a short video on discharge. And you can use these videos for your staff trainings. All right, I think this intervention might be used the most in nursing homes, or at least that's what I'm hearing when I'm talking to partners. So if you're using this intervention, that's wonderful, and feel free to share that in chat. So Teach Back is an evidence-based health literacy intervention that encourages resident engagement, patient safety, participation in care, and is straightforward and manageable in terms of training and implementation. So the goal of this intervention is to ensure that you have explained medical information clearly so that residents and their families understand. And when you use this intervention, you ask residents or family members to explain in their own words, and that's kind of the key statement, in their own words, what they need to know or do. So it's more than repeating what they heard, you ask them to teach it back. And it's a strategy for you to validate that you have explained information clearly and that residents and family members clearly understand what you told them. And the graphic you see here is from the AHRQ Teachback website, and it also offers flyers to help with training and implementation. And this one is called the Teachback Tip. And again, you can use these flyers in all staff or your orientation to teach this intervention. So you're asking residents to teach information back to you in their own words and not just repeat your words. So think about when you're trying to implement a falls intervention or start a new medication, or you're discussing a consent or reviewing the discharge plan. This is a way to confirm a resident and their designated representative understands the information. Also, use plain language. So for example, use blood thinner for anticoagulant or heart doctor for cardiologist. And sometimes we can get accustomed to using clinical language and assume the resident or the family understands, but they might feel embarrassed or ashamed to ask questions and say, I don't understand. So they just might say, okay, and yes, they understand, but leave the conversation feeling confused and possibly scared and anxious. And I wanted to share a personal story because it's just fresh in my mind. But yesterday at dinner, my dad told a story about his doctor's appointment last week. My dad is 67 and has type 2 diabetes, and it's a challenge for him to manage his condition. He's also insulin dependent, but he said that the doctor gave him a speech, that's how he described it, about how bad he's managing his diabetes. And he really only understand, again, in my dad's description, 2 words. And he said, I was wondering if the nurse knew what he was talking about, referring to the doctor. And so from this lengthy conversation, he only understood a few pieces. And his takeaway from that conversation was that he wasn't doing very good managing his diabetes. But the doctor most likely had good intentions, but didn't check with my dad if he understood and didn't use plain language. It was very, very clinical. So my dad left the appointment without the information he most likely really needed. And he felt embarrassed that he didn't understand and he wasn't doing very good managing his condition. So just some examples of options healthcare providers or the doctor could have said is, I want to make sure we're on the same page. Can you tell me what I just explained? Or I want to make sure that I explain things clearly. Can you explain this to me? Or can you explain to me how you will use your insulin pen? Which is a great question, especially preparing for discharge. And sometimes taking that extra minute can help prevent a rehospitalization or build trust in a relationship. Also, with practice, teachback can take up just as much time as a conversation you would have had not using the intervention. And then finally, rephrase your message until the resident understands instead of repeating the same way. And just to give you some eye-opening examples, in one study, up to 80% of the medical information patients were told during their office visits was forgotten immediately, 80%. And in another study, nearly half of the information retained was incorrect. So think about all the conversations that take place with residents and families in care conferences, with providers, with social workers, nurses, especially about medications, procedures, diagnoses, and discharge. Can you imagine how much of the information is forgotten or retained incorrectly, and the potential for rehospitalization? So how do you implement? AHRQ has materials that support implementation, including a patient's guide, a quick guide for staff, learning modules that are straightforward and manageable. So you can implement this into your orientation, your all staff, or your annual trainings. And you might be asking, how do I train my staff on TeachBack? Use staff meetings and huddles. Because it is straightforward, this is a great time to provide that training into huddles. And strive for 15 minutes, because again, this is straightforward. You can implement this and teach this in 15 minutes. And encourage the review of the learning modules that are available on the website. All right. AHRQ also has the Health Literacy Universal Precautions Toolkit. And I'm just going to introduce this tool. This intervention helps healthcare settings to reduce the complexity of healthcare, increase resident understanding of health information, and increase support of residents of all health literacy levels. This toolkit is 214 pages and very comprehensive to include in all areas of your health literacy in your facility. But what you see here listed here is how the content is organized within the tool. So for example, tools to start on the path to improvement includes steps on how to form a team, assess your organizational health literacy, create a plan, and raise awareness. And there's tools to improve spoken communication, which includes the TeachBack method. And there's tools to improve written communication as well. And there's a section on improving self-management and empowerment and how to improve supportive systems. And this could be a good resource that can be used to improve your overall health literacy program within your facility. So of these 3 health literacy interventions I just covered, I really encourage you to pick one of these and incorporate this into your staff orientation, your annual trainings, your huddle discussions, so that your staff are incorporating health literacy interventions into their daily care. And just to summarize, TeachBack and Share are interventions, and this Health Literacy Universal Precautions Toolkit is a tool to help implement a program. All right, I just want to take a quick minute to try a health literacy exercise. So you might have seen something like this before, but take a few to read the paragraph, and I'll just pause for a few. All right, I'm going to click to show you the paragraph. So here's a paragraph without the misspelled words. And thinking about your residents in written language, the first paragraph might be what they're trying to decode and not receiving the information they need, especially for discharge, possibly a consent or admission paperwork. All right, so let's talk about some written communication interventions. And I want to share another health literacy fact. More than half of adults living in the US have limited reading skills, but most of the health materials are written at or above the 10th grade level. So the goal is to create and provide health communications that are effective and easy to understand for residents using plain language, simple design principles, and content that is clearly organized. And residents and their families or representatives rely on written communications, whether it's a digital or in printed form, to learn about healthcare issues They receive instructions, schedule or manage appointments, and read legal documents like their admission agreement that they receive when they enter your facility. So to develop written health materials that are easy to understand, the Center for Healthcare Strategy provides 3 principles to follow. And when you receive these slides, I encourage you to access their health literacy fact sheet. And this is also can be used for staff training. But organize information clearly. So prioritize just the basics and need to know information. And group information into sections with clear and concise formatted headings. And you might want to highlight certain content. Also use plain, clear language and content that is relevant to your residents. And use short, familiar words and explain new words and ideas and provide concrete examples. And keep your messages clear and simple and use the residents' preferred language. And there are a lot of education materials in Spanish and other language available on different websites, such as immunize.org. For example, they have vaccine information statements, and they're available in approximately 48 different languages. So sometimes you just have to search for those educational materials in the language of the resident that they prefer. Also, avoid jargon and unfamiliar acronyms. In healthcare, we love acronyms, but most people, especially residents and their families, are not familiar with them. So tailor your message to what your residents know. And I use a simple layout and design techniques to facilitate reading and comprehension. So create a lot of blank and white space and use wide margins between paragraphs. Use bulleted lists to break up blocks of information. Think about the emails you receive. When there's a lot of information there, you might get overwhelmed. So keep your residents in mind when you're creating written or printed material. And you use familiar font in at least 12-point size or higher, and use dark text on a white or light background. And this helps older adults and anyone with visual impairments. And think about all the information that is given to residents and their families or medical power of attorneys, like a medication list or discharge instructions. And typically you might print right from Point Click Care or your electronic health record, or you might print something right off the internet. So being mindful of health literacy when written communication is provided to a resident or family. All right. I encourage you to leave in action and become a health literacy hero in your nursing home. So incorporate health literacy staff and resident family training in your facility assessment. A lot of you might be in the process of updating your facility assessment, so this is a great time to incorporate health literacy. Also, your QAA agenda and your resident family council as well. Provide orientation, annual, as needed staff training, and implement health literacy interventions into daily resident care, including your assessments, your questionnaires, your food menus, discharge information, your admission agreements, and your consent. All right, Jason's going to put in a link to our learning management system, but Telegen does have a new LMS where you can access a variety of on-demand quality improvement trainings. And I want to highlight 3 health equity modules involving ageism and ableism, social isolation, and health literacy. And the videos are approximately 5 minutes each, and there is an option to earn a certificate and a continuing education credits for staff. So, and if you don't have portal access, there's no worries at all. You can still access the LMS using the link here, or you can use the QR code. And if you go to TelegenQIConnect.com and click on resources, you will see our health equity resources in the drop-down menu. And on the resource page, you will find a section on health literacy resources. And this is one of our Telegen's newer web pages and updated often. So please bookmark this web page, check back often. It's updated quite a bit with new interventions and resources. So just as a side note, these slides and the recording will be sent out on May 31st. But is there any questions? Anyone want to unmute or have anything they want to share? I'll stop for a second. All right, here's a list of just some of our upcoming events. Thursday, we have pressure injuries, a past problem that remains present. And also next week, the sessions are on pneumonia prevention and pneumonia vaccines. And finally, thank you for attending this session. I appreciate you all attending, your commitment to advancing health equity, and a big thank you for everything you do for your residents and staff every day. And I hope you all have a great rest of the day.